The guy that it's think, oh, I'm a doctor, I'm a professor of that university, so the patient will arrive at me because I'm a manager of the university. No, unfortunately, no. Now we need to change our Instagram, our social medias.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. This month we are featuring the young guns, and they've proudly brought to us by Vectra from Canfield Scientific. Vectra make this really cool 3D photography system. On tonight's show, I have a dynamic Brazilian. This man is such an enthusiastic teacher. He's enthusiastic about his life. He is excellent in what he does. He's in the forefront of facial plastic surgery education around the world. He's in the forefront of rhinoplasty education around the world. It's a great honor to welcome to the show tonight Dr. Lessandro Martins, all the way from Brazil. Lessandro, welcome to the show.
Thank you, my friend. I'm so happy to be here with you with this new forum to share our knowledge. Thank you so much, and congratulations. You are a guy that is innovating how we can share our knowledge. Thank you so much.
Alessandro, it's great, man. It's great to have you on the show. So tell me, how did you end up getting into medicine to start off with, and from there into facial plastic surgery?
So let me see. In fact, I start as a ENT guy. I did my fellowship with my second father, Dr. Patrocinio, and in the end of my fellowship, I talk with Patrocinio. Patrocinio, I wanna improve my knowledge about facial plastic surgery. So I lived in Bogota with Dr. Fernando Pedrosa 20 years ago. And I stayed there for 4 months, and I saw a lot of things about rhinoplasty. That time, I worked only with closed rhinoplasty delivery. And so I back to Brazil, and I started with facelift, brown lift, endoscope brown lift. I am the first guy with the endoscope brown lift in Brazil. And before this, I continually studying. I visit a lot of guys around the world. And I start with the first facelift deep plane in Brazil. So the both topics, endoscope, brown lift, and deep plane facelift, I am the first guy in Brazil with this new technique. And I learn with guys as you. I learn every day with a lot of doctors. And something that's important, when I start with a medicine or after my fellowship, I worked with all parts of ENT, ear, nose, throats, and endoscope surgeries, everything. And with the time, I make money, so I could stop with some parts, and I start with facial plastic surgery. Nowadays, I work only with a private officer, only with facial plastic surgery, and nowadays I work with everything: ear plastic surgery, brown lift, blepharoplasty, deep plane facelift, chin implants, rhinoplasts, and some fillers. And another filler that I work a lot here in Brazil is a face fat graft. I'm in love with fat graft. It's a good technique with great results in Brazil.
Sure. Lessandro, that's amazing. It's very inspiring. I mean, there's people from all around the world listening to this, and I know there'll be numerous...
Brazilian coffee.
Yeah, have some more coffee. I am as well. But there are people around the world thinking, but my training might not just be in otolaryngology or in ENT, and here you are doing this amazing stuff. And I mean, you're doing stuff with some of the top guys around the world. I mean, I've been on some courses with you as well, and Andrew Giacono is one of your friends, and it's great to see how you keep improving yourself. What would your message be to somebody who is doing their residency and what they should be trying to improve on?
Oh, great. If I had this question when I start there in the past, probably nowadays I could be biggest that I am. I suggest that the guy need focus. You need focus. Look, if I love facial plastic surgery, I need to go away to learn with the greatest doctors around the world and study a lot, read articles, and watch a lot of surgeries. And for example, I'm not in a university. I haven't a cadaver lab dissection in my private day, and I start with the plane, facelift the plane. It's difficult, and what I did, I'm so close from Giacomo, so I thought, Giacomo, I need to learn. I need to improve my facelift. So I visit for 4 times Giacomo. I stay there for 1 or 2 weeks, watching, reading, writing. When I came to Brazil, I start with small surgeries, and then I'm go. And in the end, I was doing the deep plane. And I bought a DVD, and my son, that speak English very well, unfortunately, he will be an engineer, not a doctor. He's smart. We translate the DVD and watch 1, 2, 3, 4 times. And when I arrived in the surgery, I was completely tranquilo. How can I say? It was easy to do the surgery before studying a lot. So it's my advantage for the guys that is starting.
Yeah. No, I think it's brilliant. I've been so fortunate to visit around the world as well. No one's going to do it for you. You've got to do it for yourself, So, okay, I want a different question now. I mean, you've got a lot of social media followers, and you definitely, within the rhinoplasty world, one of those people who are adding content, and it's good content. So what are some of your things you would share with somebody in terms of the good things about social media, but also the bad things about social media?
It's a good question. Look, in the past, I remember when I traveled to Disney in my first time when I was a man, not a young guy, and I arrived in Orlando, and I got a map in my hand, and look, oh my God, where you go? Oh yes, I need to take this highway, and then the second part, I will turn right or left, so I arrive in my hotel. From my hotel to the Disney Club, how I can go. So I need to study a map to arrive in my hotel and the Disney parks. Okay? Nowadays, when I arrive in the United States, when will you arrive in your house, I will put in the Waze. Okay? The house of Cameron. And the Waze will you put me in your house. And I have no problems. I have no maps in my hand. The same thing, I think, in medicine. I'm not so young as you are talking. I'm so close from 40, 48, 49, 47.
You're a young gun, man. You're a young gun.
So nowadays, medicine needs to change. It's a new part of medicine. The guy that think, oh, I'm a doctor, I'm a professor of that university, So the patient will arrive at me because I'm a manager of the universe. No, unfortunately, no. Now we need to change our Instagram, our social medias, and something that I think if I have a knowledge, it's important to pass my knowledge for another guy. It's the same thing when you have a run, a 44 meters run, that when the first guy puts the baston, it's the score, the baton for the other guy, and the other guy put the baton until the last guy. The same thing with the knowledge. If, for example, I discovered the fishbone, if I not explain fishbone for you, when I go, fishbone go with me. And a lot of patients can improve and can have happy with some knowledge. The social media, it's so important to share this knowledge. The social media, it's very important to the patient. Watch your technique, watch your result. If you go to buy a Porsche, for example, you go to the internet in your iPhone or in your MacBook and share a Porsche. I need these wells, I need this color, I need this designer. So you watch, oh yes, that's Porsche that I need. The same thing with rhinoplasty, with ear plastic surgery, autoplasty. So now we can show for the patients what they need. So I grow a lot in my Instagram with doctors. I have a lot of doctors in my Instagram and patients. So I try to explain and share my knowledge with doctors and with patients. And I'm growing a lot. Here we say organic way. I never buy followers.
Yes, yes.
Followers. I never buy followers. I am an organic guy.
No, but that's great. And Lessandro, I commend you for that. I love looking at your posts and seeing what you're doing. It's excellent. I must keep that up. Keep it up because we need to learn from each other so much. So I want to climb into this new topic I know nothing about, is this fishbone fracture. And I think you and Sam have been working on this. Sam was one of our first ever speakers on the Rhinoplasty podcast, and he was so excited. He covered 3 topics in one talk. We spoke for nearly 2 hours, but it was a great talk. So tell us a little bit about what you want to speak about tonight. And whilst you tell us, you might as well open up your slideshow. I would remind you that there are 4 podcast platforms this goes out with, so people can't necessarily watch this, but it also gets recorded on YouTube, so some people will be able to watch it. So when you speak, I remind you that a lot of people won't be able to necessarily see your slides, so you'll have to use your best English to explain us.
Okay, perfect. Oh, perfect. Unfortunately, with the image, the screen, it's easier to understand. I'm okay. When we say, I will start to sharing my screen. Já pode?
So, Lessandro, whilst you're getting that ready, another question I have for you. What do you do with your life when you're not doing facial plastic surgery?
Oh my God. I work a lot. As you know, we're trying to do this interview. I work a lot, but when I'm not in working, I love take a ride by bicycle with some friends. I love stay at home watching movies, watch series. I'm a fan of Marvels. So I like some series before Avengers. They are doing some series every week. And I stay home with my pets. I love pets. I have a farm here in Brazil, so I need to work at my farm. So normally I go there to see my farms. I have a pig farm to a pig. Yes, correct. It's a very big farms. We have 1,500, how can I say? 1,500 small pigs per week. So it's very big. So normally I go there and I stay with family. I stopped with my jiu-jitsu. I love jiu-jitsu. So I stopped because I was afraid with my arms as I grow up with the levels. So I stopped because it's dangerous.
I heard
But
somebody tell me that
I love it.
that apparently they say it is the art of folding clothes with people inside it.
Roupa que tem gente dentro.
Yes, it's easy.
Easy for the guy who does the folding, not so easy for the guy who's being folded by these mad Brazilians.
Normal. I'm the guy that follow up the other guy.
Yeah.
And another thing that I started, but I have no time to learn, was golf. I start with golf, but we need to have time to grow up with the golf.
Wow.
So I stopped with golf.
Yeah, no, golf doesn't blow my hair back, but yeah. Anyway, let's get into. So it's fascinating. I've also got a farm, but I don't farm with pigs. We farm with game, wild animals here in South Africa, so that the patients can have their operation and go and recover in peace on a beautiful game farm. Okay, please feel free to share your screen.
Really? You have the farm?
No, I'll come and meet your little pigs, and you come and meet my wild African animals one day.
Oh my God. Okay. So we can share?
Yes, please.
What do you think?
Yeah, go for it.
Okay. Screen. Yeah. Okay. Okay, guys. I will start with this presentation. I named this as Fishbone Fracture. Every class that I talk around the world, here in South America, or in Europe, or in North America, I thought every way arrive in Rome. Some guys has a different technique, but they have a great results in rhinoplasty. Another guy have a totally different technique, and they have great results. So every way arrive in Rome. Every guy arrive in a good result of the rhinoplasty. This technique is not the new technique, but it's another parts that you can use in your day. I discovered this doing makeup course. Makeup because the woman, when they go to a party, the women use light and shadows in the face. Some place they put light, another place they put shadows. So I saw, oh my God, I think that we are doing something wrong in the fractures. Because with the makeup, they put lights in the top of the nose and shadow in the low part of the nose. So light and shadows, it's important to understand. If you have the same pictures with different colors, you can see some different light and shadows in the face, in the nose. With the angles of the face, with the cell phone, as it's normal nowadays, every guy in the world have iPhone or some cell phones, smartphones, and they use the camera. But the problem with this camera, they distorts our face, so it's dangerous. You need to be careful with this. So light and shadows, it's important with cameras. When a woman start a makeup, normally they put here in the forehead, go to the nose, and they stop in the tip of part of the nose. This is light. And from this top of the nose until the malar, we have the shadows. When we do the normal fracture, we put the same problem but above the nose. So, thinking about light and shadows, I put it hourglass. It's easy to understand. Because of this hourglass, I changed the form to fracture our nose. So I need to have this form of the hourglass in the nose. And to understand what we need to do, I forgot the name of this in English, accordion. If you have an accordion in your hand, this part, your right part, left part, is small. The right part is biggest. If you see between of each one part, the biggest part, you have a biggest difference comparing with the small part. Let's go to see this in the bone. We have a convex part in the bone, and normally the bones are different in the right and left part. If I do the current fracture here, I will put this convex part para dentro, how can I say? Inside the nose. So I will put the problem inside the nose. I will not solve the problem. With Fishbone, after I did a lot of revision, I saw that all of great names around the world do the same thing with the fractures. They put inside the nose the convex problem. And thinking about the hourglass, the light and the shadows, it's not correctly. So studying the bone, the cartilage, and the ligaments, I saw that I need to change the way of the fracture. Normally, they do the way to the piriform part to the top of the nose. Now I change the direction of the fracture. I do to the top of the nose to the malar part. It's a totally different way. Here you can see my friends almost showing us the fracture, the normal fracture. This study of Samost show how is the angles of the nose, where they are strong or weak. So before I started with a full open, I saw that all of nose we have different shapes comparing the right side and the left side of the nose. As you can see here in this picture, the left side is more convexing comparing with the right side. So what I did, I put the accordion in the nose. If I need to change the form of the nose, I need to take out some parts of the nose. So using the ultrasonic machine, after using the full open technique, so I started with a different fracture of the nose. So here you can see I'm taking the top of the nose, so I'm starting with the piezo ultrasonic fracture. So look this. I start with an angle about 45 angles. And comparing this one fracture with the other fracture, I have 5 millimeters in between with one and the other fracture. I have a small space, so I will do the same shape of the accordion. And using the piezo, I have this fracture totally stable because the perichondrium is totally stable. So it's possible using the ultrasonic technique, you can do the fishbone fracture. Without the ultrasonic, it's so difficult because you must maintain the perichondrium stable, as you can see. So now I can have look this. I can put the different light and shadows and the hourglass form, as you can see here in this movie. Let me see, I will put here. And another thing that we can change, when we have a twisted nose, I can improve a lot all of twisted nose. So it's easy to correct the twisted nose. If you have right side biggest, you will take a small part, as we do with a let down, a small part of the bone. So you can solve the problem using the solve of fishbone technique. Now I'm changing a small part, and you will see here in this movie. So now it's easy to solve the problem. Look this, the perichondrium is totally stable. I'm drawing in the skin to explain what I'm doing. So in your left side, I will take a small part of the bone, and this part that I'm drawing for you is the way of the fracture of fishbone is totally different than the way that we know around the world. So here I will correct the twisted nose. I will take out, as I'm showing here, I'm taking a small part of the body. And now, if I have another fracture, I will take a small part of the accordion. So I can solve the horizontal and vertical twisted nose. So it's easy. And it's totally stable, as you can see here. And a lot of guys came here in Brazil to watching this new technique. When they came, felt, oh my God, it's so easy. And really, it's so easy if you have a piezo ton or another machine. It's not necessarily the piezo cube. It can be another brand. It's doesn't matter. So the important is maintain the perichondrial is stable, as you can see here. So after this, I solve the problems of Fishbone, using Fishbone, as you can see here. Let me see what we have. This is, normally we have here in South Latin America, patients with a very, very thin skin, so heavy skin. Even with the heavy skin, I need to improve the form of the bone. I need to change the form, the convex to concave form. So, using the Fishbone technique, you can solve this problem. I will not put inside the nose the problem. I will solve the problem. My article is coming probably in this year. I sent to I sent this article. I think that in 2 or 3 months they will publish it. And this first part, it's 0.8 millimeters. You need to maintain with 0.8 millimeters or 10 millimeters, and then you will start with 0.5 millimeters of bonds, as you can see here. It's great. And in the end of this surgery, you see the form of the nose, how I change the form and how I improve the light and shadows. Look this, in the end of the surgery. Using the Fishbone, I can do this part as a shadow and this part as a light. Look here, the same patient. I have a different nose, so I can show a very, very hard skin using Fishbone technique. Look this. Look this. Another case using Fishbone. Have skin. We change the form of the bone. Look this. Let me see. We have more here. Yes, another woman that I show you is this woman. How I improve this nose. I'm using ribs, so as I have a hard skin, I need to use ribs. So I have a tip, inferior tip, super tip form. I have light and shadows, hourglass form. Look, with the smiles, the tip never going down, using the ribs, and the form of the bone is perfect. Another skin that I will show you. Look, this. I changed the form of the bone, light and shadows. So I have here shadows and here lights. Look this. Okay. So Cameron, that's my personal technique comparing with the others' technique. It's a new way, it's a different way. I normally say, if you have good results, continue with your results. If you stop sharing, if you have a good results with your technique, it's okay. If you watch your patient 1, 2, 3, 4 years before and see, oh my God, I need to change this. I'm not comfortable with this part of the bone. I remembered when I was using the hammer, and in the end, when I broke here, oh, I have a small step here. Oh my God, what do you do? And 1 year before you can see that step, using this fishbone fracture, it's easy. You go with this part from the top to the low part of the nose, and I'm so happy with this technique.
No, Lessandro,
Thank you so much.
it is fantastic. I'm getting piezo in our new hospital, and I'm using it around the country. I'm definitely going to do this. But I have one question for you here, because you said when guys come and see, it's so easy, it looks good. What are the warnings that you need to be careful with using it? And what are maybe some of the complications that you have found? Because I understand it, and I think it's absolutely brilliant that instead of pushing the problem into the nose, you're taking the problem away completely. You can get a beautiful result, which you've shown us. But the concern is, okay, cool, I want to go and do it. But what are the danger things that can happen and the complications?
Good question. Perfect. The first thing, the most important part of this technique, you need, it's the most important part, stabilizations of the periosteum. So you need an ultrasonic machine, because with the hammer, it's impossible. You will cut all of this part. You need to open your nose using the full open technique. You need to watch what are you doing. To do the full open technique, you must go under the fourth level of the nose, so close from the pericondium and above the periosteum. So you have your full open in front of you. Stabilizations, the periosteum. And another thing that's very important, I had a problem with this in the past. The keystone area, it's very important. Stabilization, the bone of the nose, ethmoid. If you broke the ethmoid, your nose will go down. So be careful with the ethmoid, be careful with pericondium, okay? Periosteum, sorry. And you need start with full open technique. That's the way. The other things, you can correct the nose that it's a twist nose like this or twist nose like this. You take a small part of the accordion, so it's okay. If you take a small part here as a let down, you can correct the twist nose. In my opinion, the problems as I had in the past with twisted nose, it's not a problem more. It's a piece of cake.
Yes. No, brilliant. Okay, I've got one. I still don't quite understand this. So if I'm doing a component dorsal hump resection for a large hump, but it's also twisted, or the one side's convex, one side's concave, would you still be using this technique? Because like you say, it's the keystone area that is so important to preserve and keep that in place. But it's almost like the description is it's like a mesh that you're making. So the hard bone, where you're now cutting these strips almost, means that it's more malleable and you can actually make that bone into absolutely the shape you want it to be.
Oh, it's not a problem. You can take that small part of the fishbone, and as I show in the video, and a small part in the end of the nose as a keystone, as a let-down technique. I take this both part of the bone. In the keystone area, I learned with my friend Miguel spare hoof technique. The solve of spare hoof technique solve some problems from fishbone. I saw that it's possible to change the way of the keystone area the central keystone area. With the ultrasonic, I'm going taking out the keystone bone area, so I can put the bone of keystone area from here to here. I can take this part of the lateral keystone area to here from here. So I still with a different keystone area and totally stabilization. So now I will start with my fishbone. So I can change the way the keystone area. Okay, that's okay. And now I will start with my fishbone technique. If you have a hump, start with the hump, solve the problem with the hump, the bone part and the cartilage part. That's okay. Okay, now I will go to start with a fishbone fracture. So it's not a problem if you have in your mind the spare hoof technique.
That's cool. Wow, Lessandro, it's been fantastic. So I want to close this off with asking you your 3 top tips for rhinoplasty.
Oh my God. Look, if you are if you the young guys need to have in the mind a lot of techniques, a lot of concepts. The nose never will be the same nose in different patients. So you need to be smart and to use the correct technique in the correct nose. So that's the art of rhinoplasty. It's never will be the same nose. So be careful with here in Brazil we say the Monday syndrome. What is this? When the young guy go to the conference and they came to the officer and they start with new technique, oh man, it's terrible. It's terrible. So be careful. Use a technique that you can control. Every way arrive in Rome. So it's top number 1. Top number 1. Top number 2. Never do a rhinoplasty that you are not comfortable. For example, secondary, tertiary, and others rhinoplasty. Nowadays, I'm a reference here in my part of the Brazil with difficult nose that we need to use ribs. Every week I have 5-6 surgeries with ribs. So be careful. You are not a Superman. You are not a Iron Man. So
you do look like Iron Man.
Sorry, I can't do your rhinoplasty. I will send you for a friend. So the second segment, and the last, study a lot. I still studying. I still watching. When I see a young guy told me a class, when I see a old guy told me a class, I can see the difference parts, young guy and old guy. The old guy show me the way from the young guy to the old guy. So learn with the both part. That's my 3 topics for the rhinoplasty young guys.
Well, Lessandro, thank you very much for being on the podcast. It was brought to us by Vectra from Canfield Scientific. They give us the most amazing 3D photography system. So thanks to Vectra, thanks to all the listeners out there, and come back again to listen for more of the young guns later in this month. So thank you very much for listening.